Let me turn this on. We are now ready to start our work session. Who is kicking this off? Okay.
Good morning, President Glenn and Commissioners. I'm Chris Garvin, Department of Human Services Deputy Executive Director. Julie Crow was appointed as the at-large member to the PAC, the Policy Advisory Committee, so she's up in Denver for an all-day retreat. So you have me, and I see I got the memo about wearing brown today mostly. So.
I was going to say.
Yeah, except for Commissioner Gonzalez, but you're the bright color there. So, Commissioner Littleton, I want to take a second to address your question about drug testing for SNAP recipients. And so we contacted our state partners up in Denver about that, and they provide the state regulation or the federal regulation about it. And I'd like to read that if that's okay. Okay. It says the state agencies must provide timely, accurate, and fair service to applicants for participants in SNAP. The state agencies cannot, as a condition of eligibility, impose additional application or application processing requirements, including the implementation of a photo EBT card policy. That was an example. I'll note that Wisconsin in 2014 did implement a drug testing program for SNAP recipients, and that was overturned by this rule in federal law. Wisconsin then sued FNS, and then it was heard in 2016, and it was upheld that they could not test SNAP recipients. However, there are about 13 states that do test recipients of temporary assistance needy families. But that's usually on a suspicion-based policy. If they suspect that they're using drugs, then they do test. So it was tried in Florida, and they failed when they tested everybody. So,
great, thanks for that information. And
sure.
I think it was Wisconsin that I had read about at some point in time.
Yeah,
So thank you so much for that.
You're welcome.
Update.
You're welcome. So I'd like to introduce Cheryl Schnell. She's going to give you a presentation about our adult and family services. Yes.
Morning, Commissioners. And before I get started, I just have to say, because I took my grandson to the county fair this year, and we went to the demolition derby, and I had so much fun. We both picked our cars that we thought were going to win, and I'm a pretty quiet person, and I was there yelling. I was, wishing my grandson bad luck, and I mean, it was just it was a lot of fun. So I think they should have it every week. But anyways, so again, my name is Cheryl Schnell, and I'm going to talk with you guys a little bit today about our adult and family services, and I'm going to start first with our adult services. Let me see if I've got this right. So our adult services, Colorado operates a state-supervised, county-administered system, which is really great because it gives each of the 64 counties in Colorado an opportunity to have some level of flexibility and make programs that are unique to their particular county. The County Adult Services Program provides for the safety, well-being, medical and financial needs of at-risk adults who are elderly or disabled. Our county's adult protective services teams, we receive reports of mistreatment, physical abuse, sexual abuse, caretaker neglect, exploitation, and self-neglect of elders and people with developmental disabilities. We investigate those allegations and conduct assessments of the client's strengths and needs, collaborate with our community partners and with law enforcement, and then arrange for services to reduce the risk and improve safety. Colorado does have mandatory reporting for adult protective services. In July of 2014, it became mandatory for certain persons to report abuse to law enforcement for elders defined as 70 or older. And in July of 2016, law was passed that those same professionals must also report the abuse and neglect of at-risk adults with intellectual or developmental disabilities. So this is a little bit of a look historically of our reports received in adult protective services in our county specifically from 2014 to 2017. And kind of that bluish purple is 2017. And you can see that a significant rise in reports. It's really difficult to know what that continued rise each year is in the number of reports, whether we're doing a really great job reaching out to our community, educating people about the need to report. Some of that's population size, and then a lot of it's the aging of our population in this community. And so it's all of those factors that kind of lead up to increased reports. It's not necessarily increased abuse, but certainly increased reporting. This is for 2016. We don't have the full data for 2017 yet, but this is the 10 large county comparisons. And you can see that El Paso County has significantly higher number of reports received than other counties. And again, we think that's based on our population demographics and the fact that we have such good relationships with our community partners, our professionals, and law enforcement. And then I thought it might be interesting for you to see the allegations by type for 2017. And as you can see, the biggest issue is caretaker neglect at 32%. Self-neglect follows at 31%. Then we have exploitation at 21%, and that has been growing over the past couple of years. That's when you hear on TV about all these scams, all these kinds of things that are happening. 13% for physical abuse, and 3% for sexual abuse. In addition to our adult protective services, we also provide other services to our adult population. We have several programs. One of them is the State Aid to the Needy Disabled program, referred to as A&D, and that's a state-funded program that provides financial assistance to people ages 18 to 59 who are disabled and have a disability that's going to last, a total disability, last at least 6 months, and that precludes them from being able to work. It's a state-funded program, and part of the eligibility for that program is that they have to apply for benefits through Social Security, so disability benefits, and once they're approved, those benefits pay back the A&D payments. We also have an old age pension program for adults 60 and older who do not have any source of income. Then we have a variety of long-term care support programs, everything from home care allowance, and I'm not going to read through all of these for you, but home care allowance, long-term care for people who are at risk of placement in a skilled nursing facility, alternative care facility, home and community-based services. And all of these programs are designed to really try and keep people in their homes as long as possible by providing in-home care, providing assisted living supports, and really looking at nursing facility care as a last resort, nursing home care. Some interesting information on nursing home long-term care. Based on eligibility, some people based on income criteria are eligible for Medicaid services to pay for the cost of long-term care. And it used to be years ago that there's all these rumors out there still that if you're married and one of the spouse has to go into a long-term care facility, that it really devastates financially the spouse who remains in the community. And it used to be that people lost their homes, people would actually get divorced in order to be able to have the one spouse that needed long-term care to be able to receive Medicaid services. And many years ago, that actually changed, and there's opportunities for money to be put in an income trust. There's opportunities for married couples for that person in the community to still receive additional income. And so the house is exempt, those kinds of things. So that's good news that's happened over the past several years. We also provide adult medical services. It's just kind of like a basic Medicaid. And that's what we have for our adult services program. Before I move on to our Colorado Works and Child Care program, are there any questions about adult protective services or our adult programs?
Any questions? Okay.
Right. So we can move on to the next one. All right, so next is our Colorado Works, which is our TANF, Temporary Assistance to Needy Families program, and our Child Care Assistance programs. So Colorado Works is Colorado's version of the Temporary Assistance to Needy Families program. And that program, TANF, came out of welfare reform in 1997, and it replaced the Aid to Families with Dependent Children, the old AFDC program, and really changed the look at that. I think at the time in 97, the tag phrase was changing welfare as we know it. And it really did, because it put in time limits and really moved the program from being an entitlement-based program to a needs-based program. And so really shift from entitlement to self-sufficiency. There are time limits. The federal time limit and Colorado's time limit is 60 months in a lifetime. The focus is on employment and self-sufficiency. People have to participate in different work activities, whether those be training or education. And then the federal dollars come out in the term of a block grant and to the states, and then Colorado then moves that to the counties so that the counties have flexibility in how they manage the program. The 4 basic principles or purposes of TANF I thought you might find interesting, and this came out of the Welfare Reform Act of 1997, is to provide assistance to needy families so that children can be cared for in their own homes, reduce the dependency of needy parents by promoting job preparation, work, and marriage, prevent and reduce the incidence of out-of-wedlock pregnancies, and encourage the formation and maintenance of 2-parent families. So in Colorado and in El Paso County, basically the Colorado Works program, again, is to provide public assistance to families in need who have dependent children by helping them become self-sufficient, strengthening the economic and social stability of families. In order to be eligible, you have to be lawfully present, a Colorado resident, have a dependent child in the home. You have to agree to cooperate with child support, and you have to have a family income below 150% of the federal poverty level. In our county, we have several programs available under our Colorado Works umbrella, everything from a state diversion program to basic cash assistance, caretaker support services, child care assistance, case management and plan development, job training, and job placement. And we currently serve around 2,200 families a month. When you look at these different programs, they're really based on an assessment of the family, what their needs are. And for instance, our state diversion program is pretty unique to El Paso County. It's a program that generally only lasts 2 months for a maximum of 4 months. And those are for people who maybe have never really been on public assistance, but they hit some sort of rough spot in their life. Maybe their car broke down and they weren't able to get to work. They had a child in the hospital and a lot of time was spent with that and they lost their job. They come in, they're ready, they're able to work, they have great job skills, they're motivated. They come in for 2 months. We help them out financially so that that snowball effect of them losing their home and losing everything doesn't occur. Get them employed and back on their feet very quickly. It's been a good program in our county. It helps keep our TANF numbers down so that we don't have people that get caught up in that long-term system. And I had mentioned participation, and so if you agree to be on Colorado Works, you must participate in work activities. Those work activities can be employment, subsidized employment, job readiness training, education, internships, GED, or stabilization activities. Some families come to us and they're not ready necessarily to go into an internship program, and we need to provide some stabilization first, whether that would be with healthcare needs of the parent or the children, mental health services, whatever the case may be. And the good news for us is our monthly employment goal, or our monthly employment entry, for July of this year, 246 people on our TANF program entered employment in July. And that is above the state goal, because we don't just like to do the state goal. We're going to make sure we have a goal that's higher than that. So my team has been working really hard for this. And then our child care program, because you can't help parents gain employment, be stable, be self-sufficient if you don't also address the needs for, sorry.
Oh, no, go. Commissioner Littleton.
Thank you, Mr. President. Cheryl, if you could go back before we start on the child, the CCAP. I don't know which slide it was. It was several slides back where it was talking about the, keep going, back. I'll tell you, keep going. Keep going. All right, right there.
Sure.
So when we talk about the four federal purposes of TANF, you know, the temporary aid for needy families, one of the things that I think we should point out, and I think I'm correct on this, and if not, you can correct me, but the third bullet point down where we talk about preventing and reducing the incidence of out-of-wedlock pregnancies, El Paso County doesn't in any way, shape, or form subsidize abortions at all, correct?
Oh, absolutely not.
Okay, just wanted to clarify that and get it on the record.
That's right. What we hope to do is use a two-generational approach to providing stabilities to family, education to children and adults, so that we grow and we make good choices in our life. All right, so childcare. So anytime you talk about parents being employed, being stable, being self-sufficient, we have to talk about childcare, and we want to talk about quality childcare. And so we have a program called the Colorado Child Care Assistance Program, or CCAP, that provides financial assistance to low-income families who are working or enrolled in the Colorado Works program and need child care services to support their efforts toward self-sufficiency. We have a program that works to make sure that our providers are quality providers. There's a quality rating system that's used by the state and by our county that ranks, it's a 4-star system, and so that parents are able to choose child care services that are quality-based. We do resource and referral, and we work with programs that support early childhood education. The total families receiving child care assistance in our county is almost 2,000, 1,924, and the number of children served is 3,223. And then, of course, we couldn't do this without collaborations. We have on-site and strong partnerships with Discover Goodwill's Employment Services, TESSA, because unfortunately sometimes people come into us and have been victims of domestic violence or family violence, and so we work to help provide services to them, help them stabilize as we begin to work toward that self-sufficiency plan. We have grandparent programs because sadly we have a number of grandparents who are receiving benefits through us because they're in a position of needing to support their grandchildren. We have child support services. Young Williams is our contracted partner for that. We have GED classes at Pikes Peak Library District, our Center on Fathering, which reaches out to fathers, Pikes Peak Workforce Center, Alliance for Kids, which is El Paso County's Early Childhood Council. And any questions? I know this was short and brief, but I just didn't want to give you too much, but just enough. So if there are questions.
Question, Commissioner Vanderwood.
Yes, it's not in fact a question per se, but with regard to the adult services that are provided, which was the previous presentation. I met with the president of Pikes Peak Hospice and Palliative Care yesterday. Her name is Gloria Brooks. She's brand new. She's the new president there, about 4 months. And I talked to her extensively about the services that the county provides. And she was very interested, and I did recommend that she reach out to Julie Crow and maybe have a meeting. So I'd like to just make sure you all are aware that I made that recommendation to her, so you're not surprised if she makes a phone call. And perhaps we could also reach out to her. And it's just you know, the DHS does such a great job about building community partnerships with the nonprofits and other service providers in our community. I just want to make sure that this one is good and solid as well, especially with the new president that just got here.
Absolutely.
Okay.
We'll reach out.
Thank you very much. Appreciate it.
Thanks.
Commissioner Littleton.
Thank you. Boy, I really appreciate Pikes Peak Hospice personally right now with 2 parents who are on hospice living in my home. So looking at some of the, you know, people that I think you gave a number, 200 and something people came off of assistance this year. About how long, do you have an average of how long people actually are on TANF or in CCAP at all?
For TANF, the average length of stay, if you will, is 9 months.
Okay.
It's 246 in 1 month that got a job.
In 1 month?
Not a year.
Okay.
So not a
Yeah.
year.
Well, it'd be nice to have you guys tell the success story, over the course of a year, how many people that we have on it,
Absolutely.
how many people came off of it.
Yeah.
So, because I certainly appreciate, that's one of the things El Paso County, I think, does exceptional at. We give them a hand up, not a hand out. We encourage people to really be self-sufficient instead of looking at being on aid forever.
I should have took a picture. We started an initiative a couple of months ago, which I think has kind of energized our staff. We have a board in our hallway that has a bell on it. I can get kind of crafty sometimes, so I made this board, and it's a jobs board. And so anytime a staff member, one of their clients gets employed and gets a job, they put a little pin in the board. And we have it broken down by each day of the month or whatever. And so every time that their client gets a job, they go put their pin in the board so we can track which which worker it was, and then they ring the bell. And then everybody else who works there is supposed to clap. We have child protection workers who have a meeting in a room down the hall that hear the bell, and we hear them clapping, and I think you saw that, and it's really kind of a great motivator. It reminds us that, helping people become self-sufficient, helping them find their path is really good work. It's really important work, not just in terms of, that particular parent, but for their family, for their children, and really kind of making a difference long-term, we hope.
Any other questions? All right.
I just want to thank the commissioners for your interest in our programs at DHS. I think it's so important that you understand the scope of work we do, and so I just really appreciate your time and interest in it. And I'd love to see you guys come to our department and meet the staff and see what we do every day. And I know Commissioner Vanderwerth has been there a couple times now, and so I'm really proud of our department. I think we're innovative, and great minds like Cheryl keep us running every day very smooth, I think, and I'm just proud to work there, and thank you.
If you come and hear someone ringing the bell, you have to hoop and holler. That's the rule.
Okay, anything else?
That's it, thank you.
Great. We are adjourned.
Thanks, have a good day.